that before the pandemics prompted out, I wrote an article on women, science and development, the leading role of WSD, with Jennifer Thompson and Tonya Blowers. And it has been a very important step to go to the special issue after that event. Every one of you knows very well OWSD. As I told before, I consider an extremely important initiative which has many credits on the development of women in their role in science, especially in developing world, what I call Global South, but in my opinion also in the so-called developing world, where not always women scientists are enough considered, and especially without keeping out the so-called crystal top, something like that. Let us go to the special issue. The special issue has 6 co-editor or guest editor. One is, of course, Jennifer Thompson, which is the president re-elected of OWSD. The other one is Veena Agarwal, who is one of the co-editor, and she will speak at these meetings in the next few days. The third one is Floriana Cerniglia. I underline that these come from very different continents. Jennifer from Africa, South Africa, Veena from India, Floriana from Italy, Europe. So we have also this composition of different culture, but culture which are able to collaborate, because the progress in civilization is always inside the human being if they are allowed to, in a certain way, to give expression to these human feelings. Then we have other 3 guest editors. One is Amartya Sen, very known Nobel Prize in Economics, myself, and another pupil of mine who is now in these days senior lecturer at Goldsmiths College in London, Raghupati Ventachalam. In Italian we say Raghu, which is rather a shortage of his family name and personal name. So Tonya, do you have any kind of question up to now? Please help me to go on and to do, I hope in a pretty good way, my job. Non si sente niente. No. Tonya, I don't hear you. Tonya, I don't hear you.
Sorry.
Now I hear you. Now I hear you.
No, sorry, Alberto. I was saying that I think that you've been very clear. And my burning question for you, I suppose, and it might be for anybody who's considering in the audience that they might want to set up a journal themselves, or they might want to be might want to edit together. Do you have, what was it that made you interested in the journal in the first place? What gave you the idea, and why do you think that a journal is an important expression for academics?
The journal, in my opinion, is a remarkable one. Certainly in Italy, of course, all the articles are in English, but in my opinion, also outside Italy. To be published by an Italian publishing house is very important to me, because it has an Italian roots, which means something relevant in my personal life, even if I consider myself a worldwide person. Secondly, because, as I told you before, it's not a dogmatic one. It's not just to reach success in academic career. It needs, and you want to be opened to any kind of proposal, of course, of scientific sound, but no, it is not a journal in order to have success in academic career. So in a certain way, we take also some risk in publishing article which might seem outside the orthodox thinking. This is very important to me. And the special issue we are going to publish next year is exactly along these lines of the journal. So that's the focus. That's the focus. Non-orthodox, taking some risk, and in a certain way to prompt human development. So, Tonia, you have any other question, or I go on for a while?
No, please explain to us about the special issue. I think
let's go to the special issue. The special issue has very, very important roots. Of course, as I told you, Jennifer Thompson is one of the guest editors, and as we will see later, is also co-author of an article later on. Everyone knows very well Jennifer Thompson, but I like to stress that she got a Tartufari Prize of Accademia Nazionale dei Lincei, which has an important, very important denomination: protection of human rights. Why we gave at Lincei this prize to Jennifer Thompson? Because we thought that her work on genetically modified maize resistant to viruses and drought, especially in Africa, is fundamental for the protection of human rights. So agriculture and the discovery of Jennifer are protection of human rights. So that's about Jennifer. Let's go on about Amartya Sen. Amartya Sen is worldwide known. She is a Nobel Prize in Economics, but more than that, he has been one of the most outstanding scientists and also philosopher in a certain way, living and having done contribution absolutely fundamental for the development, the understanding of the famine, the measure to fight famine and to have equal opportunity. So he is an economist, a social economist, but he is also a philosopher. So he is quite keen to human rights and to protection and promotion of human rights. As you see by these slides, Amartya, Tonia, go back for a while to slide, is poverty, famine, and all these matters. His article is really amazing because he starts saying that when he was 18 years old, his life has been saved by the utilization of X-ray discovered by Marie Curie and applied to cure cancer. And also the daughter of Marie Curie is or has been important in his life because Amartya was cured in the hospital which has been inaugurated by the daughter of Marie Curie, who has been also Nobel Prize. So he says, my life has been marked in a certain, saved and marked by two lady scientists, Marie Curie and her daughter. So it's a very touching testimony of how life can be changed by the discoveries of women scientists. Then we have, of course, Bina Agarwal, co-editor of the journal and guest editor, who wrote a very important article which will be presented and illustrated the next day, Imperative of Recognizing the Complexity, Gender Impact and Response to COVID-19 in India. Bina Agarwal will be with you, I think, tomorrow or the day after tomorrow. Of course, Bina is also very known in Italy because she has published also books in Italian. She's member of Accademia dei Lincei, so is a real participant to Italian culture and all these human aspect of our life. Let's go on. The special issue on contain 3 important articles on India. One is the COVID pandemic, gender division of paid work. The other one, labor market, and the third one on rural India. So we have covered labor market, we have covered domestic work, and we have covered rural area. Then we have many articles on South America, one on Peruvian labor market, and the other one, the situation of pandemics in Brazil connected to austerity and the crisis of Brazil, which has been really terrible. That's all about 2 special issues, 2 articles of the special issue, or better, 2 worldwide, 2 continents on which special issue has focused its attention. And finally, but certainly not last but not least, a important article on resilient women scientists and COVID-19 pandemic and OWSD analysis. So this is the so-called conclusion of the special issue. And I'm very, very proud that this announcement can be given today, because in a certain way, we consider this conclusion of the special issue a kind of blessing of our initiative. So thanks again for your attention, and to Tonia for the generous presentation she has made of my career and my personal aims in doing this kind of research and this kind of activity to promote human well-being and human fraternity also.
Thank you. And thank you so much for sharing this wonderful description of the important journal with us. And just to say that the contribution from Jennifer Thompson was also written with Erin Johnson, who's our communications officer, and undertook a huge survey of all our members, of which nearly 1,500 of you replied from over 140 countries in the developing world. And with that survey, we came to some important conclusions that many scientists, researchers around the world have been asking us, because really there was a lack of information about women scientists in developing countries. And the conclusions, I think, are, on the one hand, they're obvious, but at the same time, they are not so obvious, perhaps. And while there were, of course, some very negative experiences of the pandemic, there were also some surprising positive experiences of the pandemic. I think, and they go hand in hand. So the difficulties can be that you're in a very small space with your family members all of the time, and it's hard to work, as we've all experienced. But the positive side can also be exactly that you have more time with your families and you have more time at home. And so it's a complex analysis, and the results, I think, are really interesting. So we look forward to you all reading up and perhaps providing your comments on that special issue. So thank you very much, Alberto. And I think now Rana is going to introduce us to the next panel on the impacts of COVID. Over to you, Rana.
You have to open your Microsoft.
Yes. Hello, everyone. Thank you very much. That was a fantastic introduction to the impact of COVID on our lives in general, and in particular on women in science from the Global South. We look forward to reading this edition when it comes out. and to share it amongst ourselves and maybe promote further editions in the future, reflecting on how we have dealt with COVID going forward, both from a positive lens as a silver lining and really dealing with the realities, hard realities on the ground. But in order to learn more, we want to hear from the women themselves, from the global south, how they have dealt with these different challenges. Again, both in a positive way and dealing with the realities. So first, we're going to invite our three panelists. If we can bring them on stage.
Rana, may I add one word?
Of course, of course. Yes, please, Alberto, go ahead.
If you want to see some articles which are published online first, you go on the website of Springer and you put inside the title of the journal and you go straight away to the article which are already downloading freely. So you find the article of Amartya Sen, of Bina Agarwal, and tomorrow probably there will be also the article of Tonia, of Jennifer and Harin. But we have obtained by Springer that all the article will be freely downloading. So it's very important also that because no one has to pay anything to see the article and to download the article. So we are very proud also for that.
That is very, very helpful. Thank you very much. And maybe we can put in the chat in the main room the links to the articles for those who can take them as well.
You find all the article online first, freely downloading. Economia Politica, Journal of Analytical and Institutional Economics. It's a mixture of languages, but Economia Politica is Latin, is Italian, is Spanish, any kind of, well, there are many, I mean, I speak not English, I speak Globish, which is another language.
Great. Thank you very, very much, Alberto, for that, for sharing that information. And thank you, Tonia, for leading and all the great work that you're doing in supporting all the women scientists around the world. Your work is very, very valuable. Thank you very much.
Thank you to you and to Tonia.
All right, everybody. So welcome back to the second part of this session, which is discussing the impact of COVID on our lives as scientists from the Global South. So I would like to invite to the stage our fantastic panelists who will share with us firsthand from the ground what's happening. So first, I'd like to invite Mashura Shami. Mashura Shami hello, Mashura. Mashura is an associate professor of the Department of Environmental Sciences at Jahangir University in Bangladesh. I'm sorry if I mispronounced it. He is also an OWSD 2018 Early Career Fellow. Welcome, Mashura. Second, we also have with us Teresa Umuhoza, who is a research epidemiologist by profession and PhD scholar at the Institute of Tropical and Infectious Diseases at the University of Nairobi. Her research focuses on viral infectious diseases, which is very timely with us today. So welcome, Teresa.
Thank you.
And we also have with us Dionysia Gamboa, who is an associate professor from the Department of Cellular and Molecular Sciences from the Faculty of Science and Philosophy, and a member of the Institute of Tropical Medicine, Alexander von Holt, and both at Cayetano Heredia University, Peru. She is also an OWSD 2013 Early Career Fellow, and her research focuses on malaria. So welcome, Dionysia, and if I'm pronouncing your name wrong, please tell me.
Okay, good morning. Thank you.
Good morning, good morning. And I am Rana Dajani. I'm a professor of molecular biology at the Hashemite University in Jordan and chair of the Jordan chapter for OWSD. And I really welcome you all three today with us. So just to share with everybody the format of this session, we will invite each panelist to give us a 5-minute talk reflecting on her own experience with COVID-19 during the pandemic. And then after each one of you shares her experience, we will have a half an hour discussion covering different points, and then open it at the same time to the audience if they have any questions that they could post in the chat that we will look at and also try to answer, and then wrap up with a recommendation that we can all go home with. So without further ado, I'd like to invite Mashura for you to start by giving us a 5-minute reflection on COVID-19's impact on your work and that in your country. So the floor is yours.
Okay, thank you very much, Anna. First of all, it's a wonderful opportunity to share my experiences here in this platform. And I'm grateful to host for this. Last year, when COVID-19 began in March 8, it was the first time we got our first case in Bangladesh, the COVID-19 case. So after that, people got a little bit concerned because that time in China and other countries were much more higher number of COVID-19 cases. So we had started lockdown from March 26th, and we could not go to our universities. We could not carry our labs. Like all the lab proposals we had to postpone it for that time. So my colleagues and I, we are thinking of what to do, how to utilize this time, because we are staying at home, getting bored, because that time we also could not carry our online classes, that no instructions come yet. And we also had no idea about those technologies. So my colleagues and I, we were talking that maybe we can start an online survey that how this COVID-19 pandemic is affecting the socioeconomic people. And we can use some statistical tools, some statistical techniques, data analysis, analytical tools. So out of that idea, curiosity, we started some online survey using Google Forms. And by May, we got reasonable amounts of data. And that time we started writing our first paper on the socioeconomic stress in from developing countries and with a limited resource, how those people are responding, how the country we need to tackle this situation, strategic analysis kind of thing. So we developed some scenario analysis that if there's a long-term scenario, if there is a short-term scenario, and if there is an intermittent lockdown, what could be done? Because our country, they depend on the export earnings, and this is a very difficult, because people are very poor in many cases, and people, they are already lost their jobs, they don't have money, already there is a hunger is there, poverty, which was below 18%, is now again returned to 48%. So it was a little bit stressed up situation. So from there, we thought that maybe we could devise some, give some idea that how the strategic scenario analysis can help the government, other countries also, that this is helpful for tackling the COVID situation, or in a pandemic situation, or in a disaster situation. So from there, we wrote that article, and we found that people responded that the socioeconomic situation, they cannot cope up. But the government, they need to give some subsidies, they need to give them incentives, they need to give them, improvise them, that how they can tackle the situation. And also the R&D sector, that ready-made garment sector, that is our country's most important earning area for earning money, earning US dollar. So that area, those people, they cannot cope up the situation. They need work, they need factories to open to survive their life. So this we are coming out, our data was showing that they don't want this lockdown for a long time. If the lockdown is there, some health distancing, like the social normal that was going on, standard normal scenario, like using mask, sanitation, health and sanitation, those things are necessary to help those people. And also the factories need to run always. So these were the scenarios we developed, and later we prepared one popular article for the newspaper, and we submitted 4 articles to one to Springer, one to Frontiers in Public Health, most probably, and one to another Elsevier journal, Helion. So all 3 were accepted. So we were very happy about our outcomes, and still after 1 year, most of those papers got 100+ citations, and we are very proud of it. The colleagues we are doing together. So this is the responses from our side, but the problem was at the home, we are staying home, but it was difficult because we have kids also, right? So we need to take care of the families. we need to take the classes again, we have started online classes. We cannot go to the lab. Other than this, we have to do everything. I mean, this was a bit stressful. So I think everyone can understand the situation here. And in the developing countries, we need to do everything ourselves. So this was a bit tough for everyone of us. Yeah. So this was our situation, and we now we are getting a little bit normal because the COVID-19 cases in our country is much more dropped now. The vaccination program has started that we have suggested there that when the vaccination program starts, everything will become much more safer. So until now, I think everyday cases is now 7 to 6. So it is much more safe. We can say that policy was much good of taking the early vaccination program. So compared to the other developing countries, the country is doing great, even within huge population.
Thank you very much, Mashura, for sharing with us how you are coping, you and your fellow citizens in Bangladesh, and how you have been innovative in shifting. If you can't go to the lab and do research, how you shifted and did a new kind of research that probably you're not used to, and that was a learning curve by itself, I'm assuming. And then learning and sharing that information with others so that you design better solutions and help people at least be aware of what they're going through by documenting it from the people themselves. So thank you very much. All right, so now I would like to invite our second panelist to share with us her experiences in her country and how things have been affected. So Teresa, the floor is yours. Welcome.
Oh, thank you, Rana. Thank you to you. Thank you to OWSD to host us. And thank you for having me. I am so grateful. So from my experience, I have been working with disease surveillance or epidemic intelligence and health information system for approximately 10 years now. I am inclined to carry research on viruses. And I had great opportunities to work with local institutions in Rwanda, my home country, and also in collaboration with international programs, where I did mostly work on arboviruses, such as Rift Valley fever, Zika virus, and other zoonotic viruses. So it's around 2017 where I initiated a collaboration in Kenya and joined the program for surveillance of influenza and other respiratory viruses. Now we include the SARS-CoV-2. Before the COVID-19 pandemic, my research, mainly with the program, was to conduct investigation on non-influenza respiratory viruses, such as RSV, respiratory syncytial virus, parainfluenza, and adenoviruses, to look at the epidemiology in Kenya, to provide the insight on the burden of those diseases in Kenya, their seasonalities, and also risk factors, as well as identifying the hotspot region in Kenya. So my interest in surveillance led me also to join a community of subject matter experts as a moderator at the program for monitoring emerging diseases, is known as PROMET. It is hosted by the International Society for Infectious Diseases. I joined that community, I think, 2 months before COVID-19 pandemic escalation. So we had a workshop in January 2020 in Abuja, Nigeria, where we discussed on the use of such a platform to alert and report the occurrence of outbreaks and pandemics in different parts of the world. So, but at that time, that platform had already alerted or warned about the occurring pneumonia of unknown origin in Wuhan, China. And I looked at it now and I asked myself, it wasn't that, it was really information given on the right time. The platform, so every day we post alerts from different parts of the world. And myself, as a moderator, I focus on outbreaks occurring in East African community and other East African countries. Of course, for those English and French-speaking countries. For example, currently I am tracking the outbreak of Ebola virus occurring in DRC Congo. So the early warning surveillance system, they are very key for our community to get to be aware of the diseases that are occurring. ProMed is publicly available. You can subscribe. You can log in and subscribe and get to know about the outbreaks that are occurring. Myself, at the beginning of the pandemic, I felt submerged with a lot of information because I had to keep up with ProMed notifications so I can keep tracking the pandemic. And also I had my research that was focusing on other respiratory viruses, which was contributing to the threat of public health. So what I did is I defined the priorities, then allocated time. I found myself diverted when the whole team, for example, my team I operate with, were assigned to track COVID-19 pandemic in the front line. Then I had to keep up and telling them there are other respiratory viruses that are posing threats to the public, so we should keep considering. For example, there is a time I had a signal of the upsurge of influenza-like illness outbreak in Kenya, and in one region in Kenya. So my colleagues were telling me about the COVID-19, and then I had to tell them that, to remind them with all the knowledge we have that RSV is affecting young children, and the season was getting in. So with even the knowledge we had, we were like overcrowded with the COVID-19 information. We almost lost the track, but it was critical to keep the balance. And then I was amused because I found that happened to other scientists, different parts of the world, where I joined as a moderator an exchange program. We discussed on the significant impact of COVID-19 on influenza surveillance and other respiratory viruses. I think that's a bit of what I can capture from what happened to us, to our research, and then here we are. We managed to publish about other respiratory viruses. It took 1 year to get my publication out, but I am grateful. And then also I published 2 papers about things that has nothing related to COVID-19, and it's amazing. So we didn't lose that much track. Thank you.
Thank you. Thank you very much for sharing that journey and how you were actually at the forefront when COVID hit, because the saying that chance favors the prepared. So because you're always outreaching, you're involved in all these networks because of doing your due diligence, you were really at the forefront when COVID happened. And that's such an important lesson for us all, that it's all about perseverance and persistence and following up on everything. And how you're still involved now, tracking and knowing what's happening. And it would be great if you, later you could share in the chat on the main stage the link, so other people can register if they want, whether out of curiosity or if they are also involved in infectious diseases, so that they could be part of this. So thank you, and we'll come back to you in the discussion. I have more questions on your fabulous work. You're welcome. So now let's invite our third panelist. Dionysia, the floor is yours. We want to hear from you and how you're dealing with the COVID within your research lab and your country.
Okay, thank you very much for the invitation. I'm just going to make a quick summary about this COVID situation in my country. So far, I downloaded data from yesterday. We have 11.4% rate of positivity of cases, Unfortunately, 9% of people dead because of this disease. And about where the regions are more affected, mainly in the Amazon region, unfortunately, where the positivity comes from 15 to 20%. And of course, Lima, because it's the capital city, we have around 10% of positivity rate. And about the vaccination, so far we are having 16 million people already got the 2 doses. So it represents around 48% of the total population. That's good, and we hope to continue in that trend to get all the people vaccinated. About how this situation, this COVID pandemic affects research, well, the first case was reported here in Peru, March 6th, just the day I was coming back from Iquitos, from the capital city in the Amazon, because as I already told you, I work in malaria in the Amazon region. And when I arrived here, it was a big news about this confirmation. And in March 13, the government declared that lockdown. It's supposed to be for 15 days, then 1 month, then it extends until June 30. And because I'm working mainly in field work, of course, we have to suspend everything. So it means in the middle of the field work, we have to bring all the people back to the city, from the rural areas to the city. We have to close the labs because we cannot go to the university to work on the research. And finally, the lockdown finished in June 30. But we have to start implementing a lot of procedures to going back in a safe way to work in the lab and also to work in the field. So what we had to do, we have to be very creative as scientists. We have to adapt ourselves first to have meetings online. No, we have to start learning how to use all these technical tools and try to keep people engaged in different activities, journal clubs, and discussing some projects and writing papers that were pending for so many months, and reports, supervising the thesis, and at the same time to adapt ourselves to give classes online also, because we are also a professor at the university. And finally, in this year, in January, we come cool back to the field. And of course, again, in the middle of the Amazon with more than 35, 40 degrees, we had to learn how to work with a mask and with all this biosafety protection, and to explain people also that we are doing that to protect them and to protect us also, and try to help them, not only, I mean, in malaria, that is our main research, but also doing some educational activities about COVID, no? The importance of the use of masks, and also the social distance. We have to adapt, for example, instead of doing interviews for 20 minutes, we have to adapt to doing in 10 minutes maximum. So it was a lot of learning process, are still going on, because this will last at least for many months more. And now we are preparing ourselves to go back to presential activities at the university, for example, and this is another way to start preparing ourselves, and also the students, because nobody wants an outbreak at the universities. It's a slow process. We have to be very patient, and we have to adapt ourselves to this new normal that we are going to face in the next months. And also what I did directly to COVID also, but at the beginning I was part of a technical commission that gave advice to the Minister of Health on how to use the best tools for diagnosis. That is my main also expertise. And in addition, the institute, the Tropicales Institute of Tropical Medicine, they start doing some courses about, for example, the molecular diagnosis, how to use the biosecurity measures, and also to support our colleagues, physicians, biologists, nurses, giving all these tools to protect themselves. And also, we had to really support our collaborators, because among the people that work directly with us, we have a lot that had very sick, and the families were very sick. So it was really a lot of things going on, but we have to learn to manage as a team and to support them. And well, this is all I can share with you. And once again, thank you very much for the invitation, for the opportunity to share this experience with you.
Thank you very, very much. That is for sharing how you dealt with the pandemic, what you did in terms of your own research and your wider community and society in Peru. So we would like to have all our panelists now back on stage so that we can start the discussion to share and dig deeper from what we've learned from you and what the audience is asking. So we're waiting for our third panelist, Mashura. Is she here to join us? Mashura left. Okay. All right. So we'll start, and we hope that she will join us soon. Hopefully, it's just a temporary technical glitch in her system. From listening from all three of you, from Peru to Kenya to Bangladesh, so we're really going all over the world from one part to the other and back. I hear three themes coming out, and which I would love to learn more about and hear more about before we deal with the questions from the audience. So first of all, I hear about you're all scientists and you're researchers, and because of the pandemic, you have dealt with your research in different ways. So some of you, like Mashura, has actually changed her path of research and went into doing surveys to try to understand how the people are coping with COVID, which is fantastic. And to me, it's a shout out that as scientists, we're always ready to change and to learn, and we're open to being uncomfortable again, which is good for our brains to always be challenged. But I also hear from you, Teresa, how you actually harnessed that and used it because of your position in infectious diseases and being on that platform that you mentioned and shared with us, how you were able to navigate that. And Dionysia, how have you dealt with that? I'd like to know more from you. How have you managed your research in relation to COVID? What have you done that's different? Dionysia, it's a question is to you. How have you how have you changed, if
me.
you have? Yeah. How have you changed your research path as a result of COVID?
Okay. Well, at the beginning, as I told you, we have to close everything because first was the safety of the people, no, of our collaborators, mainly in Iquitos, because in that city we had a huge outbreak with almost 70% of the people got infected. So what we had to do is try to, adapt ourselves. As I told you, we have to start looking for alternative activities to do with the people, but try to stay connected, no? Because it's not that because we are in Lima and they are in Quito, so it's you're there and we are here. So we have to do these activities, even just social meetings online to discuss about what was happening in the lab in Iquitos, here in Lima, what we can do to help people, because at the beginning it was just to help people in Iquitos, sending masks, sending gloves, and we have to really stop our research for some months because they need first our help. And then, of course, we try to start working again, independent reports, pending papers, pending theses, because that's the only thing we can do during this time. Lab work, we have to start the lab work again in August, but little by little, because we have to reduce the number of people in the lab to 50%. So it means that we have to adapt our schedule, no? And also, hopefully, the funding agencies, they were very understanding, and they say, okay, first is your safety, your mental health, and then we can readjust the schedule, and you can get some extension on your deadlines. But first, please be safe and try to do the best thing you can during this time. So that's why, hopefully, with that, we can manage this first last year, because all the last year I don't consider loss. I just consider that a little stop on our research. But now we are just going again and try to recover this time. But of course, it's different, no? I mean, with masks and with gloves, and try to be more quickly, not very effective as before. And so, hopefully, it's going very well, and people are very well adapted.
Thank you. Thank you for sharing with us how you are recovering, like you say, the time lost and dealing with within the restrictions on still being able to conduct science regardless of those restrictions. So, Teresa, I would love to know more for you to share with us about now with all these modern digitized surveillance systems and all the access to the internet for people to report from across the world on what's happening. You talk about information overload, info obesity you mentioned, which I thought was a fascinating word. So could you share more about what are the positive and negative impacts of this overload of information or the infodemic, and how can we deal with it in a positive way while still avoiding the negative?
Oh, thank you. It's a tough question. It's very challenging now, but with what we have seen, we call like infodemic or infobesity. For example, we had a lot of overload, which we had good information and also we had fake information, and you had to come up with strategies and tools to filter what was right, what was wrong. Nowadays, because now we are equipped, we have technologies. We have developed some are free, others are priced, but there are tools outside there where you can use to mine information. For example, I will give you an example with the program I work with, Promet. We have collaboration where we have a program that assists us to do the mining of information related to outbreak and epidemic studies around the world. And mostly you can also, as an individual, as a researcher, from my experience, there is our program. It's a program, and then they have developed, European Union has developed a package where you can use that package specifically to filter information related to outbreaks, diseases. So I take the advantage of that. Package is free of charge, and you can have it and you can use it. There are several tools for researchers they can use to filter information related to infectious diseases. I will maybe post a link for what I use in my daily routine work and activities. So it is very challenging. Information overload is, at the beginning, I felt submerged. I couldn't manage, and I was receiving notification, and I think it happened to most of us, I believe. But I had then to tell myself, you have to focus. And by focusing now, you develop a routine where you have to know exactly the priorities for you, and then you have to allocate time for specific tasks, and then take the advantage of the technologies we have. If you don't have, you can try to filter information by defining your priorities and your keywords. That's how I did manage my work and then also my research. But from other colleagues, we are still, it is too much information and structured information. You can't be based on such information to draw a conclusion. So that's why we have to develop people with skills to do like reviews, like systematic reviews, like doing like meta-analysis, like also doing using other techniques or approaches, to mine the data and to synthesize them, and then to make decision based on such information. I hope I have answered your question.
You have. Thank you very much. And actually, you answered one of the questions from the audience on how do you get the data, from where do you get the data? So thank you very much. And actually, you ended with a very important point on how do you use that data to help inform policy and inform society and those decision makers and leaders. So welcome back, Mashura. I'm glad you're back with us. And that's a question to you. So you've done research looking at the impact of COVID in adopting this new methodology of doing surveys and gathering that information. So my question to you, usually as scientists, we're always in the lab or in the classroom. However, COVID has allowed us to realize that we have to play a role outside our labs to help inform, use the information we've gathered or we have to inform policymakers, to inform society leaders on how to deal with these real life issues. So my question to you, how have you used the data you've collected to help inform policymakers or leaders in your community?
Oh, thank you very much, Rana, for asking this question. We have collected those data out of this survey, and particularly we wrote several popular articles like op-ed to the newspaper, and many of them were shared by the policymakers, and also our papers that we have published from the scientific journals. Those were also what's that called? Shared by the policy makers like World Bank, ADB, and other policymaker bodies in our country. So this was a good opportunity for us, and we thought that okay, our research has some impact to the policymakers, and then we also did one research on the COVID-19 waste management. It was also very good way because one of the top NGOs in our country, they connected with us, and with them we did some surveys on the COVID-19 waste management also. And out of that, we use a lot of personal protective equipments, we use a lot of gloves, a lot of masks. How developing countries which has less resources, how can they manage it, right? So this was a question. So later, even we are now working on particular this COVID-19 waste management related legal policy revision, that the medical waste management law that we had, it needs revision, it needs update. Now we are working also in this area. So already we have 3 colleagues we are working, and also we are working on the training module development for the doctors and lab practitioners for how we can better management this COVID waste. For the waste management also, we are preparing the documents. So it's a good way we are spreading our knowledge that we have already gathered. And I can mention you that with one of my colleagues from India, we wrote one paper on how these developing countries like India and Bangladesh can work on this waste management. So this is the way we are working, because when something is stopped in the lab, we work in our home, and as much as resource we can. That's the way we work.
That's amazing. I mean, thank you. How your research takes us on paths we never imagined.
Right.
So
right.
you
We never imagined.
Yeah, from
and
COVID.
I can also add one thing. For several organizations like small NGOs, they have online platforms. They invited us to share our experience on our research, particularly the waste management research we have done. It was shared several times, and it was published in Environmental Science and Technology. This was a review perspective, but it already have a good impact on that.
So that's fantastic. So your research, you've not just shared it in the, let's say, the public domain of academia,
right,
but you've also shared it with neighboring countries who share the same culture, context, and challenges, so that you could learn from each other rather than reinventing the wheel. That's fantastic. And you've also talked, you said, to local NGOs and local newspapers, I'm assuming, which will help remove fake news, which leads me to going back to Dionysia, for you to tell us and share with us, how have you combated fake news in your community? What methods you've adopted? Because you're a scientist, people trust you, you come from the same community, so you become a new kind of leader, right? To dispel myths and give out solid, positive advice. So how have you dealt with fake news, Dionysia?
Yes, of course. There was a lot of need from the general public to know about this virus, about the treatments, the vaccines. So a lot of demand of people, of scientists going on TV, on radio. And of course, to do this, we need also some skills. I consider myself not as good communicator as I wanted for a general public, for example. No, I can do a presentation about molecular biology, diagnostics, but for a technical group, but to translate this message in a very simple words for a general public, even for my family, for example, because all of them also call me what to do about this, what to do about that. The people saying this WhatsApp group on the Facebook. So I have to try to learn how to speak without this technical jargon, and try to really to confirm all the information that they were looking around, to confirm if this is really solid information, trustable information before giving answer, because we are still facing this problem of a lot of information. A big percentage of that information are really wrong. So we have to learn how to correct this information and give these people the good information. For example, now about vaccines, most of people are afraid about vaccines, and we need to explain that we need to use the first vaccine that is available, and these are good to face this pandemic. Even try to combat all this wrong information about how damage the vaccines could do to the people. No, and this is the best thing I do. And for example, I try to learn some techniques about communication skills. How to be assertive in my talks, especially if I'm going to talk to the communities or at schools, because I'm also invited to schools, because it's really difficult. It's also another learning process that I think this pandemic is a positive result from this pandemic. How we as a scientist learn how to communicate in an easy way all these scientific facts that sometimes are difficult and they consider like a very strange word, no? Because we
it's so
sometimes are very
important.
difficult talking.
Actually,
Yes.
it's very important. Like you said, it's a new skill that we should learn, and I think every scientist should learn, because science is all about serving humanity. And if we can't get that message across, then how can we really
Yes.
serve? Especially
Yes.
when you're from the country, people trust you, they want to
Exactly.
hear you. So one question from the audience, and I'll ask all three of you: has your engagement with society or your research that you've done that's related to COVID had an impact on government policies? And this is like a quick yes, no, and how. Dionysia, since the floor is yours, have you been able to make a change on government policy? And then we'll go to Mashura and then Teresa.
But not directly in COVID, because I was working mainly in malaria. But for example, we did a quick study about the impact of COVID on malaria, because we are seeing the number of cases going down very fast. And I think, malaria is eliminated because of COVID. It was not. It's because people that go to test the cases or to report the cases, they were sick. There was nobody working at the epidemiology unit. There was nobody reporting cases. And for example, with this report, we made aware that it was not the malaria going down. It was going down, but not as fast as we thought. It was the main reason was because there was no reporting. All the health system was occupied with this COVID situation. But for malaria, yes, most of our resources are included in this Malaria Zero Plan, that is a new elimination program of the country.
Wow, that's fascinating. Mashura, have you been able to impact policy in one way or another?
I think if we say it like, for example, for the NGOs and NGOs we are working with, BRAC, maybe you know about that. BRAC is a good NGO. So in one of their work, we did one survey for them, like this medical waste management. It was a very good, well accepted. And then one of my colleagues, he's also doing another work with another lawyers association, Bangladesh Environmental Lawyers Association, on the revision of the medical waste management rules that is currently we have. And we are emphasizing that it should be revised, because that is already outdated and it cannot actually contribute to make waste management for the current situation, for the pandemic situation, and also for the normal situation. It needs a revision. So it is, we are working on that also, and particularly on the training section. And this has been well received already. Yeah.
Thank you. No, that's amazing. Teresa, do you want to comment on this?
Yes, I will say that impacting on the policy that is being around is a process. So there are a lot of things we don't know about, either for this COVID, how it did impact on other pathogens. So we are still carrying on research. From my research and our team, we have ongoing. Maybe you have to give us like the next 3 years, so we can communicate. And yeah, it's a step by step and slowly. But I believe that all the policy we had now, they are based on the previous knowledge. So we are adding information to the previous knowledge, and we are publishing about that. For example, my research I was carrying, we have identified the hotspot for the respiratory viruses I was looking at. Maybe we are going to look at the next then how if we include COVID-19, because COVID-19 is new data and we have to look at it and then we can inform the police makers. Thank you.
Yeah. No, thank you. And we know policy takes time. We know that things have been accelerated because of COVID and people's concerns, but even with acceleration, it's going to take time. And I think one of the questions was, do policymakers read academic papers? Probably they don't. And that's why, like Mashura and others, you've been writing in your local language reports that hopefully policymakers will read. And they must, because of the impact of the pandemic on their everyday lives. So now I'm going to move to some of the questions from the audience were actually more personal. And I'm going to have a round of asking you how each one of you, has dealt with the mental health, your mental health, that of your family, or your lab teams in coping with COVID-19, whether because of the isolation, how that has impacted you with your loved ones, or your team members, how you have helped them, mentored them in dealing with the impact of mental health, COVID on mental health. So again, go back to Dionysia. Do you want to share with us briefly how you have dealt with that? And then we'll go around.
Okay, thank you very much. Yes, we have a lot of people in our group that had these anxiety events because they feel isolated, because we usually go to the lab every day. We meet at least once a day. So it was really difficult. So what we had to do is to talk with them, even by phone or by these technological tools, and try to calm down and say that, okay, this is a new situation. We need to adapt. And if they want to talk, just please call anybody that is available just to talk every day or at any time. And also we have to help a lot of people because, as I mentioned before, a lot of people from our group got hospitalized. So, and I mean, the economical situation also was a big impact for all of them. Even if we try to keep in contact as much as we can, we had to help them with medicine, with payment of the hospitalization and any other things. So it was really a stressful situation, but as a team, I think we passed this terrible situation because that's I think the main thing we had, no? To work as a team in order to support everybody in the team.
Thank you, Dionysiad. Mashura, do you want to share with us how you have been dealing with mental health and the impact of that on you, your family, your community, and your lab and your research team?
Thank you very much. When the COVID-19 outbreak happened in Bangladesh, just in earlier June, all my family were isolated because we also affected by COVID-19. My husband was a doctor, so whenever he comes, he brings some disease, particularly the infectious one. So we had COVID-19. He was hospitalized for 3 days. Very tough time, and then we could not go there. Then my another family member, my sister-in-law's husband, he was in ICU for 11 days. We were isolated at home. My parents in another just a 30-minute drive from my home, they were also suffering from COVID-19. Nobody can visit. It's not a normal time. So during the time, I had a good support from my colleagues because we used to talk to them almost every day that how much we are writing, how much we are progressing, how much we are reviewing the articles, so how much data we are collecting. So this was a good way we were coping with the bad situation, because it was like making us happy during this bad time. Because when we are happy, we get a good positive vibe from each of us. So this is the way. And of course there is my child. He was making as much as possible to make me happy, like making jokes or making something positive. And this is the way we are keeping everyone healthy, mentally healthy, for the family, for the colleagues, and everyone.
Great, thank you, Mashura. Teresa, how have you been dealing? Tell us both your family, your community, and your lab and research colleagues.
Oh, okay, thank you. I will say that, yeah, we were in the same situation. But for me, for example, we start with my team, my research team. I was told to work from home because I am the epidemiologist. They will be sending data, so I have to sit in front of computer and they have to analyze. And the team is in the lab, others are in the field, and we create a WhatsApp group to tell each other what is happening around, the process of responding to the COVID-19. So it was tough for them because they were outside. It was tough for me, who was also inside, receiving information from them because three of our team members contracted COVID-19 and they communicated. They had to isolate, so we have to talk every day via WhatsApp, our WhatsApp group, checking on each other and finding out what was happening. And unfortunately, one was a senior reading PI, and we were so terrified. And luckily, he got out of it, and we were safe. So from in the morning or during the day, I was following up with the team. In the evening, then I'm dealing with my family. It was not easy, and my family is not in Kenya, is in Rwanda. So I will be listening to them. And also one of my family members also contracted the disease, but luckily she got out of it. I would say that I had to manage both sides and to look at it and provide really information and try to make sure that everyone gets safe, but is not possible. It was out of my hand. And personally, what I did was to look for the information. What can we do? What are we doing with the information we have? And then and sometimes get a little bit disconnected out of the screen and have my moment of drinking maybe water and try to stretch. I did. It was very tough. Sometimes I will wake up and I will stand in front of the window. I will just not ask myself anything, just try to, make myself relax. So yeah, that was it. And I am glad then we had the vaccine, so we had to prioritize. I remember arguing that, okay, it's okay, me, if I'm not vaccinated, but the top, because vaccine shortage is here, we have it. And I was saying, it's okay, me, you can forget me, but first of all, vaccinated those ones who are in the labs, and after that I will come in. So luckily we all had the vaccines, and we are okay. We are doing much better now.
Thank you for sharing your perspective and how you've dealt with the challenges and bringing up the vaccine. So I actually want to talk about the vaccine in your different countries. But before that, I just want to mention one thing. I think what I've learned from COVID-19's impact is how the world is so flat, in the sense that we are all in this together. And everyone counts, regardless wherever they are. We're only as safe as the last person is. And it really reminded me, people talk about global north and global south, developed and developing countries. And the COVID has shown us how we're really all the same in terms of humanity. There are people have behaved, and how they've reacted all over the world is pretty similar. And actually, we've seen wonderful responses and collaboration and coordination in developing countries that I think developed countries can learn from. Across the African continent, across Southeast Asia. And I think these lessons should be written about, should be shared, because we always tend to think that the solutions are coming from one part of the world towards the other. And I think there's a lot the world can learn from each one of you, not just our panelists, but all our OWSD members across the world. So wonderful and amazing lessons. Please always stay tuned with all the OWSD conference and attend all the sessions. Now, I want to talk about vaccines. So we would love to have Tonia back with us to represent what's happening in Italy as well. So welcome back, Tonia. I want to talk about, hello. I want to talk about vaccines, and I'd love to hear from each one of you a number of points. One, how have dealt with the vaccine? How have they accepted it or not? What are the strategies that you, as a scientist who is kind of a leader again, a beacon, have dealt with helping convince people that vaccines are important, while dealing with the caveat that, yes, it's a new technology, there's a lot we don't know, how to deal with that? And it would be really lovely to hear from each one of you about that. And we can start with you, Tanya, since you're fresh on the panel, to share with us what's happening in Italy, and then we'll go around to the whole every member of the panel.
Well, thank you, Rana. Actually, the question is a really appropriate one because, as you know, the Trieste Secretariat is based in Trieste, in Italy. And in some ways, Trieste has become the epicenter of what is here known as the no-vax. Lots of people who do not want to get vaccinated, and in Italy they brought in this green pass, which is I don't know if you have that in your countries. It would be really interesting to hear, but we have a green pass, which means that if you've got your vaccinations up to date, or if you've just recently had in Italy it's a tampone, a test, a COVID test that's negative, then you have this green pass, and it's one of those QR codes, that you can literally, you show it on your phone when you enter a restaurant, when you get on, wherever you go into a closed space, you need to show this green pass, but then you're allowed to enter. You should still have your mask on, but there's a huge rebellion against this because, for all sorts of reasons, it's seen as being, authoritarian, and that's the difficulty. I think it's also linked to some political and economic difficulties in the country. So, we know that developing countries have huge challenges economically right now, especially, for example, Mashura, I know in Bangladesh, women in particular suffering greatly because of the casual nature of industry, and women are the first ones to lose their jobs. They don't have proper contracts. They have part-time contracts, all those kinds of things. Here in Italy, generally, there's a huge number of people who are not paid very well, whose conditions are not great, who are on, really hard shift duty. And those things are all kind of coming to the fore now as they're being told that they must get vaccinated, and they feel they're not being listened to. So I think it feels to me that all of these things all come together. But as I say, Trieste particularly is a very interesting place from that point of view right now. It's a kind of a melting pot for the whole of the country right now.
Thank you for sharing what's happening in your country, in your hometown. All right, so Teresa, back to you. Can you share with us how people are dealing with vaccines in your country, in Kenya?
Thank you. I would say both sides, like Kenya and from also Rwanda. From my personal experience and also what we are experiencing here, there is one thing of resisting to get vaccinated because of misinformation. Let's say that is what we see. And then also there is not being vaccinated because of other reasons, like a shortage of vaccines. So yes, they have been resistant, and the countries, they are trying hard to communicate about the vaccines. There are campaigns. We are explaining to people. Let's start in our surroundings, among ourselves, scientists, nurses, health professionals. It's a new virus. People don't understand. They ask themselves a lot of questions. So you have to explain in details. And then also there is a concern that now we don't have enough vaccines. So what if I get vaccinated and then the virus becomes seasonal, and then I have to get vaccinated again? And then what will happen if the vaccine is not around yet? So that is one of I learned that when I was explaining to my young sister. So she wanted to get vaccinated in Rwanda, because in Rwanda they have started with elders, and then they go to the high-risk population. And then they said, okay, now we can vaccinate the youth. they are trying hard to make sure that the doses they can cover the population as much as they can, but still there is a challenge. So she asked me first, oh, they said we can get vaccinated, and now I want to get vaccinated. I say, first, the priority is the elders. We have to ensure that our parents, grandparents, and other people can have access. They said, okay, fine. Then she asked me, so what is going to happen with the vaccine? Explain it to me. I tried to explain it to her. She has no background in science. And then I explained to her that the vaccine is going to protect you. Yes, we might. She asked me, so for how long? Because she understood that when you get yellow fever, you are covered for a long time. I said, we don't know yet. She's like, that is then tricky. So yeah, I had to explain to her that what if, she asked me that question, what if we get shortage of vaccines and then we have been vaccinated, what will happen? So we are working on that, and we hope that countries, we shall be able to manufacture in the coming years, to be able to manufacture enough doses so to cover the population. And then if it is going to become seasonal or annual vaccine, we don't know yet. We don't have yet enough data. Then we are going to be able to keep up with the coverage for the immunization. I think that's...
No, thank you. Thank you for actually raised a number of very important points.
Thank you.
One of them is how much we don't know, right? This vaccine has been developed in less than a year, which is absolutely phenomenal and fascinating. And I want to highlight, but the reason we were able to develop it so quickly is because it was built on the shoulders of giants who were working on basic scientists for the past few decades. And that's a shout out to basic science, that how much we need basic science. We may not see in the immediate future the impact of it, but we know now that it does have an impact and it will pay off at some point in the future. So this is a shout out to basic scientists, a shout out to governments to keep on supporting basic science because of that importance. You also raised another point, which is the uncertainty. This is a new vaccine. There's so much we don't know. And all drugs and medicines and therapies, we learn by trial and error, by experience, with time. And we don't know a lot. And I think it's how do we maintain that balance of saying we don't know while conveying some kind of, let's say, trust that, but still, even if we don't know, this is the best shot we have. This is the best thing we can do. And let's embrace it and take it and go forward, because we know that we are protected better because of this vaccine. And the only way to learn is by using it as we go forward. So, and again, a very important point. And I think scientists, the problem with scientists, they're very accurate. Well, it's not a problem, I know, but I mean for the public is that we will always give but we're not sure, right? Because we're scientists and we're always very careful what we say. And unfortunately, people in the media are very certain when they say something. And so their information gets conveyed in a much more, let's say, aggressive way. So how do you maintain that balance of building trust? And I think that's why scientists have to be more vocal, share with their community. And when people know you and trust you, they'll understand how you say things. And when you say, I'm not sure, but I think this is the best thing, they will go with it, which is actually one of the questions. Oh, go ahead. Yes, Teresa.
Oh, sorry. Yeah, I was going to add some information. I wanted to let you know that yes, that is good to clarify that we don't know, but we also have other measures which are non-pharmaceutical. So we are combining both. We keep the mask on. We also have the hand hygiene and also the social distancing. So it's key to clarify that vaccine is alone, they are not going to take to keep protecting us as we are progressing, as we get a new research on, and then also manufacturing enough vaccines. We will have to keep other control measures, not leaving them aside.
Thank you. Yeah, and absolutely. So there's so many measures we can take to protect ourselves, and we need to remind ourselves it's not just only about the vaccine. So now I want to go to Mashura. If you want to share with us how you have been dealing with the vaccine in your part of the world, and also if you want to share with us how do you convince people who don't want to take the vaccine? right? What's your argument? How do you talk to them? What do you invoke as you discuss that? The floor is yours.
Thank you very much for asking this question. Actually, for the vaccine, initially I was also afraid. So because this was developed less than 1 year, as you have said. So first set of vaccine that we received in Bangladesh was from AstraZeneca. It was produced in the Serum Institute, India, and it came to our country, but it was for the frontliners, particularly the doctors, the security people, and for the old age people. So obviously people were reluctant to go for this vaccination program because people were afraid that what are the side effects, what are the problems there. So actually I also didn't know that what about it. So after few months later, I mean, they were releasing the age restriction. Like first of all, in the 70s group, then the 60s, then the 50s. So this way it was going on. But unfortunately, there was also evidence coming that people without vaccine were dying. Some people had some complications after COVID, and then also people with vaccine also had problems. So this was a problem because there was a lot of infodemics about this vaccination program, that a vaccine doesn't work. Okay, so even after getting a COVID vaccine, I am infected, but maybe the problem is less. So when this type of data were coming, so people, I think I think personally it was not, I'm not a vaccine specialist, but we were trying to convince people that okay, it is safe. Even I think in the Facebook wall, in our Twitter, in those type of social platform, we shared this message that this vaccination is safe. If you have COVID-19 vaccine, your problem will be little less than the general situation. So take the vaccine, be safe. And even still today, my colleagues, they share this message to the other Facebook walls that vaccine is safer. And initially the people had some stigma regarding the Chinese vaccines from I think that is called Sinovac or other. So this was a problem for people to understand that okay, this Chinese people created this problem, this virus, so their vaccine is not trustworthy, and they don't know the technology. But we convinced that no, Chinese vaccines are okay. Those the Sinovac, Sinopharm, those vaccines are just fine as the other vaccines. So when we started sharing those messages to the people in the social media, I think now people are much more eager to take vaccine, because now if I remember well, just a few months ago there was like mass vaccination program in our country, and a lot of people were in line for getting the vaccines. And there is there is some restrictions that people who want to go for work in other countries, like in Middle East, like Saudi Arabia, in other countries, you must have to have some vaccine certification. So when this message was coming, the people getting aware that okay, we also need vaccine, and whenever we want to apply for any visas, any other thing for other countries, we need to show those certificates that okay, I have 2 doses of vaccines from the authority, I can go there. So when these are coming, people are getting vaccinated, and even in the local root level, like in the villages, people government have given this restriction that okay, you must have to have vaccinated. For the school, even I think this last month, school children like from 12 years, they were also registering for this vaccination program, and that they must have to have vaccines. So this is the way our country is going on. I think the progress is very good, and there is like very good strong position from the government regarding vaccination.
Thank you. Actually, you raised something important, is that, always it's negative news that gets in the headlines, because there's so many people who are taking the vaccine, but that's not sensational news, and nobody wants to talk about that. They want to talk about the negative. And I think that's a good shout out, that we need to tell the positive stories to get, and that way that becomes mainstream, and that's what people hear about, and that becomes contagious in a good way. A good way. All right. So to you, Leonacia, tell us, how are you dealing with the vaccine in your country? How are you advocating to convince people, and what are the challenges in that context?
Okay, well, here in our country, the campaign say that the best vaccine is the first one that arrives to you. So that's the first thing we need to tell everybody. And unfortunately, at the beginning, we have a big problem with the vaccine because it was a big scandal, political scandal. Unfortunately, that's why when sometimes politics and science mix, sometimes there is no good things out of that. So that's why a lot of people lost trust on vaccines, because there was a lot of misinformation from different point of views, and this confused people. That's why after this scandal passed, we try to advocate to get the vaccines, not only the first one that arrives from China, but also the other vaccines. But people still with this message on the head that is not good because as Mashura said, the virus was created by the Chinese, so the vaccine must be not good, so we need to wait for another. So it was a really complicated to regain the trust of the people. And in this process, scientists, we have to face this problem and try to convince people again to gain the trust again that the vaccines are good. I mean, there are different kind of vaccines, different ways that they were prepared, but and comparing with malaria, for example, that took 40 years to get a vaccine, we got a vaccine in a very quick time because it was a huge effort from different scientists behind the scenes working very hard to get this vaccine. So on the news, on the TVs, on the social media, we have to answer all the doubts that family, friends doing. And for example, in the different networks, we have to inform all the vaccines are good. Of course, there are different percentages of safety and efficacy. Of course, these are complicated terms, but in general, they are good. They protect yourself, they protect your family. And as Tonya mentioned before, the government is advocated, for example, to reopen activities if people get really the 2 doses, no? This green pass. If you have your carnet with the full 2 doses, you can go in to display, you can do this, you can do that. And even, for example, for the social media, okay, we are going to, again, to meet each other only if we have the 2 doses, for example. In that way, we are promoting that people get to the vaccines. There are a lot of campaigns every weekend, be it Vaccine Fest, they call it like that. But now they're vaccinating people under 10 years old, for example. And we are, as I mentioned before, already 48% of the total population getting the 2 doses. So I think it's slow. It was a very huge process, try to gain the trace, but I think we are getting, regaining the trust of the people. And that's why my message here is, please don't mix politics with science, because sometimes it's not good.
Yeah, thank you. That's a great message to end your sharing of dealing with the vaccine. So let me, we great kind of reporting from around the world on how people are dealing with the vaccine, and maybe I'll throw in the mix because we have representation from the African continent, from the South American continent, from the Southeast Asia continent, and I'll throw in something from the Middle East, where we're kind of all vaccination rates are around 50%. People trust in science and in medicine, but we always have those naysayers that are suspicious and talk about conspiracy theory. And it's all about facts, sharing, and having a voice, and using social media, different leadership outlets to convince people of what is right and what is true. And most importantly, it has to be from the people, from the local scientists, to speak out and to share in the local language to build that kind of trust. So thank you very much. This has been a fantastic panel, and I'm going to wrap up and actually with 3 points that I think are important takeaway messages that we have gathered from this discussion. First, I want to highlight one thing which was mentioned, I think, by Teresa, is that the importance of fairness and social justice and equality. We talk about people refusing to take the vaccine, but in many cases, there's not enough vaccine to go around. And I think this is something we should talk about. We should call for equality, because if not everybody gets the vaccine, even the richest person is not safe. And I think that has been a very clear, important message that we need to take into consideration and advocate, to have enough vaccine for equality and social justice, and to reach that last mile, to reach that last village and that last rural area, forest, jungle, where island, and make sure that everybody gets the vaccine to protect them and protect all of humanity. So that's something that we need to keep in mind. The second point I'd like to highlight is the importance of scientists and you, every one of you, every one of our panelists, every one of our OWSD members, every one of our listeners, and every scientist in developing countries around the world, how your role is so important in making scientific discoveries and in contributing to the scientific discussion, because science works in teams. If we want to solve the 21st century challenges, we need everybody to be on board and to share and to collaborate. Today, actually, I'm in Berlin at a conference called Falling Walls, and we had Özlem Tursi, who is the discoverer of the COVID-19 Pfizer BioNTech vaccine. And she gave a fantastic talk. She herself is an immigrant from Turkey to Germany. And she and her husband has led this discovery. And so the importance of all of us in contributing to science and in being part of that is a very important message for the next generation, that we all count, wherever we come from, however we look, whatever language we speak. We are all important players in this for humanity to help us. And maybe the third message that I'd want to share is that we need all of us to write our stories, to share them, so that not just the global South and our people can learn about us and be inspired, especially not just the women, but also the men, so that they can support us, but also to dispel stereotypes in the global North about how we have to work together to make a difference. There were some questions in the audience about immunity, whether vaccines work in pregnancy. I'm not sure if any of our panelists want to answer that, but I think these are more technical questions that should be addressed at length and should not be taken lightly, because one cannot advise on a panel that was not geared for this kind of thing to be prepared. So if anybody wants to ask more technical questions, I think we can reach out in the conference, in the main meeting room, between sessions, or email the different members to answer those questions that they have raised. Other than that, I think we had a fantastic panel. Thank you very much to everyone, and I'll hand this back to Tonya.
Hi. Well, Rana, what a fantastic job you've done as a moderator. I think really congratulate you on pulling everything together and, making sure it's such an interesting conversation for everybody. The comments that have been coming in, I don't know if the panelists have had a chance to have a look at, but you won't see them all here, of course, because we're in a different room from the main stage. But there really are lots of wonderful positive comments, and I think people have particularly appreciated just hearing back from the kind of on the ground experience from, all different regions of the world, and just to get some sense from these different countries of what's going on. Obviously, within the regions, there's great variety too, but really, really interesting discussion. And I think the panelists, if you want to, you could have a look at the comments that have arrived on the main stage, and you could perhaps go in and write your own replies to those comments and keep the conversation going throughout the 2 weeks, because I think something that's come up as well from the things that you've been saying is how difficult it has been to talk about the mental effects of COVID. The short-term, mid-term, long-term effects. Of course, we don't really know exactly what those will be, but I think that some of you have started to talk about those openly and honestly and courageously, and I think hearing that other people are in similar situations and that we're not all heroines is also a very important message to get across. So thank you all. We really, really enjoyed listening to you. And I'm sure there'll be lots of tweets about this panel going around the world right now. So thank you very much. So my task now is to just tell you about what's happening tomorrow. Just remind you what's happening tomorrow, and then I'm going to take you through how to access the poster session that's coming up immediately after this. All right, so don't go away. So happening tomorrow, we are thrilled to have our internationally renowned speaker and guest, Fabiola Gianotti, who is the Director of CERN, Director General of CERN, which is the European Organization for Nuclear Research. She was the first ever female director of CERN, and also, as far as I understand, the only ever director of CERN to be given a second term. So not only is she the first woman, but they thought she did a fantastic job, and they've asked her to stay on. And of course, that's a hugely important job. She's a nuclear physicist and will be giving a talk tomorrow entitled Scientific Research, a Key Asset for the Future of Society. That will be at 3 o'clock for half an hour. But before that, we have a very important panel discussion. So the theme tomorrow is the importance of basic sciences for development. And Rana had just began to talk about that just now, saying, you know, how important basic science has been in order to come up with solutions, vaccine solutions. You know, you don't know at the time what's going to be necessary and useful, but without basic science, we wouldn't have vaccines. And you know, what we understand of applied science is the vaccine, but we forget about the background to get there. So I think that will be a really interesting discussion. I mean, really thinking about what do these fundamental, so sometimes called pure sciences, sometimes theoretical sciences, often called basic sciences, how do they also contribute to development? And also, I think a related important question is, how do such sciences get funded by development agencies, for example, that might have a hard time persuading governments and populations that they are doing something that's going to have an impact on the economy? So the first panel is going to be moderated by Shobana Narasimhan, who's Professor of Theoretical Sciences and Physics in India. And Shobana has been involved for a long time with OWSD, and she's run some wonderful career development workshops for women in physics. So she's a highly regarded physicist in her own right, and she's offered to moderate the panel tomorrow. And we have 4 fantastic panel members. We have Marian Nkansa from Ghana, who is an OWSD Elsevier Foundation awardee. She's also a very strong member of the Global Young Academy. We've got Marisa Nkua Ngavuka, who we all know as Marisa. I've never had to pronounce that whole name before. Sorry, Marisa, if I got that wrong. She's from Congo, Brazzaville, and she's the recipient of our OWSD Early Career Fellowship and has just become, we heard, assistant advisor to her government. So she now has a position of influence and power, which is wonderful. We have Hannah Rodriguez-Hertz, who's full professor of mathematics in the Southern University of Science and Technology in China, but she's originally from Argentina and did a lot of her academic career in Uruguay. And she is just the outgoing vice president for the Latin America region of OWSD, and did a tremendous work for OWSD. So we're really pleased to see her come back. And Kate Shaw, who's a researcher in physics at the International Centre for Theoretical Physics, which is the campus where the OWSD Secretariat is based in Italy, in Trieste. And she heads up the ICTP Physics Without Frontiers program. So she really is somebody who takes theoretical physics and takes it, uses it in a very applied way. So 4 very interesting people to make comments tomorrow. So they will be followed by Fabiola Gianotti's talk, and then Fabiola Gianotti will be interviewed by another very important physicist. Her name is Rana Reyes. She's from the Philippines. She's currently associate professor at the National Institute of Physics in the University of the Philippines, and she has given TED Talks, and she's a great science communicator. So we're looking forward to meeting her tomorrow. And then there will be time, there'll be half an hour. Probably Fabiola Gianotti cannot stay on, we're not sure, but we'll have a continued question and answer with all the panelists and with Rana Reyes discussing this really interesting question about the importance of basic sciences for development. So please do come. And please do, in the meantime, if you have time, keep exploring the lounge area, keep exploring your sidebar menu. Now I'm going to tell you how to join the poster session, which is going to start in about 6 minutes' time. So you've got time to go off and get a coffee beforehand. And we're just trying to see if we can give you a live introduction to what you need to do to go and visit the posters. I'll go here. Okay, the posters is that one. No, sorry, go to the lounge.
Sorry.
Okay, so you need to click on the lounge, which is this coffee icon. Once you're in the lounge, you click through, join us in the OWSD lounge, you click on there, and then you'll see, it takes a little time to load, and this is the exciting place where you can, so first of all, you need to allow GatherTown to use your microphone and your camera. And now you're here, and you can, if you haven't already, you can create your avatar, which means that you can add a hat. Here we are choosing our hat. You can add glasses if you like. You can put things in different colors. You can put clothing. You can put shoes. You can do all kinds of things to create your own avatar. And then next step, you press the button next step, you name your character. So I think I should name my character Tonya. What do you think? Seems like a reasonable name. And then I go finish. Now I've got my avatar. I join the gathering. So I click on join the gathering. Sorry, first of all, I need to... Okay, that's okay. I'm trying to join the gathering. Right, here we go. So it tells me, hello Tonya, let's get started. I'm Riley and I'll be helping you learn the basics before you enter OWSD. Use the arrow keys on your keyboard or these to move around. Okay, so I'm going to click on these then. No. Here we go. We're moving around. Okay. So you can try muting yourself. So if you're in the lounge area, it's good to keep your microphone on and your camera on. That means if you bump into anybody, you can talk to them live. We're skipping the tutorial because we already know how to do it, but you can all click on that if you would like to have a tutorial. Okay, now look, there are other people in the lounge area. Hi everyone. Do you want to go and talk to anybody? Erin is helping me here doing this because I can't do everything at once. Are we talking to anybody here? Hi Tatiana, or hi Rama. Anyway, now we're moving here. You can see the Asia Pacific corner. Just above the Asia Pacific corner, you've got the poster rooms, okay? Where you'll find all of the posters. Now, you can see there's two different names here for the poster sessions. Here we've got OWSD members' responses to COVID-19. That's where you're going today, and that's going to take you to the live session. And once you get to the live session, you can meet different people who are all in front of their posters. Shall we see if we can talk to anybody, Erin? So let's go up to Ekena. Is Ekena there? So you need to press X to view the poster. Here we have the wonderful poster, Ekena's wonderful poster. And I think that we can start chatting to her if we would like to. But she's not there. Okay, another time, Ekena. So we'll leave there, we'll press on the cross button, and now we're going to go. How do we know if the person is there or not? You need to, the person might be there, but they might not have their mic on, that's the thing. So remember, all of the poster presenters, you need to put your mics on. And your cameras on also if you would like to. We've got the national chapter here. I think it's the national chapter of Guatemala. Shall we see if they're there? Yes. Here we are, Guatemala. Is there anybody there? No. So is there anybody that we can go and visit? We're going up to Mira. It's going to be a bit hit and miss this first time, everybody. This is the first time any of us have done this, but it's quite exciting. So shall we go to, now we should be able to talk to Mira. Hi Mira, are you there? Well, I think it's going to work better for you when you're in the room. If you have any troubles, you can always go to the info desk, which is also available on the left-hand sidebar of your, on the left-hand sidebar there. Okay, so shall we come back out of here now? And I'll come back and wish you all well. We're going back out the door. There we are, back into the poster rooms. You can always look at the posters anytime you want to by just scrolling down the menu bar on the left-hand side, where you will find, once you come out of this space, oh, we've got Abdulaziz Azimat. Hello there, Abdulaziz, can we speak to you? Hi, you need to turn your microphone on. Hi, Tatiana, are you there? Can we speak to you? You need to take your microphone off. Oh, they can't hear me.
Yeah, it could be that.
Okay. Well, we're going to leave here. Sorry, guys, because something's not working for the people that are in the poster room and they can't hear me, I think. So sorry about that, everybody. Anyway, just to say, let's come out of this room now and we'll go back into the main lounge space. And I'll just show you, if you want to go down the menu on the left-hand side, exactly, you can click on the posters. You can just click on the poster anytime you want to, and you can view any of the posters in any of the sessions, for example. And then when you click on them, you'll see that they come up beautifully, and you can read everything. If there's an arrow like there is on this one, if you click on that one, you'll get the video. So it really is a very wonderful interactive experience for you, and you can get all the information you need about the posters, and then you can turn up to the sessions and speak live to people. You can also just communicate via chat with anybody's poster that you like, and just send them a message and say, I really like your poster, you're doing research that I'm interested in, can we get together for a chat anytime that's convenient to you? So thank you all so much. I think now it's time for you all to go off to your poster sessions. And I hope you have more success than I did just now, talking to each other. So looking forward to seeing you all tomorrow afternoon at 2 o'clock for the basic sciences session, and maybe we might bump into some of you right now in the poster session. Ciao everybody, bye.